there's the ones that are medically necessary that most people get as a septoplasty, meaning like the divider between the two sides on the inside. If it's crooked, we'll straighten it up. It's like a little hot dog shape. 3 of them. There's the inferior, middle, and superior. But usually you don't do anything with the middle or superior. They're inside. Your nose is bigger than what people think. It runs from about here to almost your ear. And we'll shrink those down if they're big and inflamed. Every surgeon is huge experience. And as you get more experience under your belt, the stress of it isn't as much. But I still mentally prepare like the big game for every surgery. Some of my colleagues are looking at like using AI to create like ideal faces for surgical goal. I use a Photoshop program because it is a good way to communicate, but it's not to the detail that like an AI would be, because AI does a lot.
The season of health is on cruise through HTX, and a brief reminder before we get started to please, for the love of all things sacred, talk to your primary care physician before trying anything you hear during any of these episodes this season. Okay, Dr. Sturm, feel free to not answer this question.
No.
You piqued my interest just today. What is it with doctors and ties?
Okay, so there's a study, and I remember this from medical school, so forgive me if I don't get it right, but okay. They cultured the ties of the doctors, and it grew all kinds of bacteria. And so you're not supposed to wear a tie, you know, if you're a guy, obviously, like in the hospital, because you lean over and you listen to people's hearts, and, you know, it touches everything.
And when you say people's hearts, you're talking about a surgical setting?
No, I'm talking like with a stethoscope. So like, let's say you're in the hospital, you're the patient, and I'm leaning over with a stethoscope, and I'm listening to your heart and your lungs, and I'm feeling of your abdomen, doing like the physical exam, because we're a good doctor, and we do
that's what you do.
Physical exam, and you're close proximity to this person, so your tie may touch their bed or their bedding or even the patient, you know, and then you go to the next patient and the same thing happens.
And then you multiply that times
over and over. Yeah. And so that's why it's frowned upon to have like long ties.
Right.
And also why I don't necessarily like wearing a white coat.
I mean, can't you just take it to the cleaners or?
Yeah, but do you wash the white coat every day? You can, but then you need to have at least 5 white coats. Yeah. I'm not saying you can't get 5 white coats, but
no, I understand.
Do people really do that?
Would it be more of a nuisance, I guess?
Yeah, it's kind of a pain, I guess.
It's like I have a pair of white shoes, and I mean, they get dirty really easy, but having 5 pairs, and maintaining them, headache.
It's a lot of effort
for a little payoff.
Yeah. Whereas, you know, I'm obviously not going to wear a tie.
Yeah.
You know, so that's not a problem for me. And then for a guy, you could wear a bow tie, and that fixes the tie problem. You know, of it being a fomite transmitting disease.
You know, my client, Dr. Patton, wears bow ties.
Yeah,
maybe
he does.
That's why? I don't know.
I think a bow tie is a great option for male surgeons.
There's no dragging down, and you don't have to worry about.
Yeah, and I don't know, the white coat just kind of gets in the way, and then you're just around a lot of different people, you know, just in general as a doctor, and I would prefer to wash it every day, but like that's a lot to keep up with that many and wash it.
Yeah, really. You're saying that you'd have to, you know, in order for it to not be filthy, you would have to wash it every day. And that reminds me of my wife, who likes to wash 2 towels at a time in order to not overwork the washer. And I'm like, honey, we got 15 towels. And
we have more than 2. Yeah.
It just seems like a lot of unnecessary work.
It's a lot of work. Whereas, because, you know, at this point when people come to see me, they know who I am. They've seen me on my website. They know who I am. I don't need to show them I'm the doctor because they already know.
Yeah.
You know? Because that's part of it too, is like in the hospital, like this length, like a long coat means you're the doctor, the short coat means you're the medical student. The resident has a longer coat, and everybody, there's other people that have coats, but like in our world that it's signifying who you are. Like, I don't feel like I need to do that at this point in my career.
You've been doing this for 5 minutes.
I've done it once or twice. They know who they're coming to see.
Yeah.
I don't need, I don't necessarily need it. I only wear it if I'm wearing like business casual, and then it feels weird if I don't have it on. But if I have my scrubs, I don't wear it.
Gotcha. Okay, so something else that I had learned in working with you through your podcast and doing some research and trying to work on your newest series of Beauty Unveiled is that there's actually a medical reason why somebody would get a rhinoplasty, which is something that you specialize in. So why would somebody need to get something like that for health reasons?
So there's different parts of like that procedure, and there's the ones that are medically necessary that most people get as a septoplasty, meaning like the divider between the two sides on the inside. If it's crooked, we'll straighten it up. So a lot of times you'll know this because like one side you can breathe pretty well out of, other side not so much. It can contribute to snoring, is usually not the only contributor, but it can. And then you have turbinates that look like little hot dogs inside the nose that heat and humidify the air.
They look like hot dogs?
That's the shape. It's like a little hot dog shape.
Oh.
There's 3 of them. There's the inferior, middle, and superior. But usually you don't do anything with the middle or superior in most cases. They're inside.
Like inside.
Like run from... Your nose is bigger than what people think. It runs from about here to almost your ear inside here.
Okay.
And we'll shrink those down if they're big and inflamed.
How do you shrink those down?
A lot of different ways you can do that. So the way I do it that is most reliable for me is so you take a hot dog and then like transect it, right? And so it's a circle. So I'll cut out like a piece of pie, about 20 to 25% at the bottom of it, like a little pie, and then use a cautery to bring it together. So it's physically
I'm sorry, what's a cautery?
So it seals blood vessels. And so it keeps you from bleeding after surgery, during your...
Which is helpful.
Yeah, definitely. Nobody wants that. So instead, I don't like sew it up. I guess is what I'm saying is I don't sew it up, but I use this little wand that like shrinks the tissues and brings them together. Okay,
because blood vessels and all this stuff seems very small. Okay, even for a big person, seems like it's teeny tiny. You could have like the smallest of hands and they'd still be so ginormous compared to what a blood vessel is. My mind is blown that this is a thing and that people, it's wow. Okay.
We have all kinds of toys and tools and
yeah. Okay. So somebody comes in to see you because of the uneven breathing thing, and then do they come back after a few years? Like, is that, I guess, does it matter how they take care of themselves, like improving their breathing strips, or I don't know, more exercise, or they breathe better? I don't know what factors play into whether or not they come back and see you.
Some of it is like underlying allergies. So if you have, and people generally know, like I'm allergic to a lot of different things or not so much, or do I have like a runny nose or sneezing and like those sorts of symptoms. If they have underlying allergies and don't really treat that is possible that over time, because that's sort of what happens is those turbinates just get bigger over time.
Turbinates?
The turbinates, yeah, that's the little hot dog.
Wow.
So those can get bigger over time. The way that I do that turbinate reduction is what I've found most reliable, that it's not going to come back. There's a bunch of different ways you can do it. You can heat it from the inside. You can take out some of the tissue from the inside with another little tool. There's a bunch of different tools you can use. But for me, with those, there was a higher rate of, it's really great. I can breathe really well right afterwards, but somewhere between 3 months and years later, they were like, now it's kind of back, which I want you to have surgery once and then never have to think about your nose again. So that's my ideal situation. So I physically make it like that turbinate smaller.
Okay, so this is kind of blowing my mind. and by kind of I mean very. Now, what other factors come into play when let's say, because you do facial plastics as well, reconstruction from an accident, all that other kind of a thing. But let's say, I'm trying to phrase this question here. Sorry, y'all. This is going to be an edit point. Let's talk about a medical procedure. Well, it's all medical procedure. Let's think in terms of someone having an accident and they need to come and see you. What is the degree of, oh, I can live with this, to, yeah, take care of that?
So from like an insurance standpoint, let's say from what you're going to get your insurance to pay for, what they care about is, can you breathe through your nose? They don't care if it's on your ear.
Oh.
They want to know if you can breathe through your nose. That's all insurance is going to cover. So even if it's crazy, they're not going to cover it. But they will cover, like I said, straightening the septum on the inside, shrinking on the turbinates. There's little grafts that you can put that work kind of like breathe right strips, but they're inside, and I use cartilage. I know this is a whole different thing.
Okay, breathe right strips that go inside?
So they work like breathe right strips. So your septum, like the divider between the two sides, is made up of cartilage in the front,
right,
and then bone in the back.
Okay.
And so I take some of the cartilage from the septum, from the divider, and then I create these little, we call them spreader grafts. So they're tiny grafts that go inside, and if you like take your finger and you hold out your cheek, that's what it will feel like. So it's spreading open the internal nasal valve, so the valve between the cartilage right below your bone, this cartilage, and then the septum on the inside.
Oh, gosh.
Should be 10 to 15 degrees, but if you have trauma, or some people, it's just the way they are, it's narrower than that, but it's the narrowest part of the airway. So even if it's a couple degrees narrower, you're going to feel it. And so what I do is take that graft and put in between this and that septum to widen that airway. And it's tiny. It's like, I describe it like a tiny 2x4, like a 2x4 millimeter, teeny tiny.
Like,
teeny tiny.
Wow.
And so it doesn't change the shape of your nose on the outside. It just makes that valve more open on the inside. And that is something that is functional, that is to help you breathe. That's not cosmetic. Those are all like medical reasons to have surgery.
You're literally picking noses.
In medical school, you get to pick the orifice, and I choose the nose.
Y'all, she said pick the orifice. Well, okay.
Of all of them, the nose, ears, nose, throat, that's not bad.
No, it's not. No, like preferable.
Yeah.
Because you actually started, you wanted to be an ER doc.
Yeah.
In the beginning.
Yeah. That you're doing with everything, all the things.
And it's a surprise too. It's like,
oh yeah,
I didn't have that on my bingo card.
Yeah. Yeah, you see it all. You see everything.
What made you decide that? Like, was there a particular procedure that made you just think, oh, okay, yeah, facial plastics, I'm done with this?
Watching Dr. Brissett make a ear out of a rib. That's when I chose facial plastics. So I left ER. I decided no ER when I decided I really like to fix the problem. In ER, you come in, you stabilize the patient, and then you're like, okay, I'm going to get you a follow-up with so-and-so, and you get to follow up. You either get admitted to the floor and someone else takes over the care, or you get a follow-up with somebody. And so you don't get to close the loop, basically. Mm-hmm. And I didn't like that part of it. I want to start to finish. So I liked ENT. One of the reasons was that, or ear, nose, and throat. I liked ear, nose, and throat because you got to manage that patient start to finish. They come in with a stuffy nose, and you could say, okay, well, let me manage it medically. Here's some sprays, here's some medications, blah, so forth. And then if that doesn't work, then I can do surgery, and we can fix the problem for you. And generally, that's a problem that you're like, fantastic, I'm good, have a nice life. You know?
That's ideal for you.
That's ideal for me because I'm like, I've fixed your problem.
Right.
And it's very satisfying to be like, yay, I fixed the problem. We're on to the next thing, you know. And then, and specifically ENT and facial plastics, because I watched Dr. Brissett make an ear out of a rib for a kid that didn't have an ear. And that was pretty amazing. And you created an ear, you know, and you get to give people back seeing themselves, you know.
Mm-hmm.
Give them seeing themselves, or give that back to them, depending on what it is.
Right. If there was a different kind of specialty, I guess if you can kind of, it's always easy to kind of armchair quarterback it. I mean, if rhinoplasty wasn't a thing, like what would have been your plan B?
I almost was an OB-GYN, because I liked, you know, women's health. It's a similar idea of, I see you in clinic, I manage things medically, and then I also manage things surgically, so I can do both. It's a special point in someone's life. You know, you get to be part of something really special with them. You know, people trust you in a very intimate, specific way. You know, like they have to trust you for you to be their doctor. They need to trust
right.
you. You know, and it's not the same, but it's a similar feeling of like being pregnant with a baby. Like that's your whole world, you know.
Yeah.
And then it's your face. You
know? Only get one.
Only got one face, you know. So it's a lot. You know, they give you, if they choose you as your doctor, they trust you a lot. It's a big deal, you know.
When you first started, what was that like? Like, I imagine every surgery, there's got to be some kind of pressure, or maybe there isn't. I don't know. But when you first started compared to where you are now.
Yeah, I mean, it's definitely a lot of stress, you know, and I treat it like sports, like that's the game, like the big game. Every surgery is the big game, you know, and you prep for it beforehand, and you have the chart, and you go over in your mind exactly what you're going to do, and you come out, you know, you think about the steps, and you go over and over it in different scenarios. If this happens, is what I'm going to do. And, you know, you can't do everything, but you try to go through your playbook of all the things that could potentially happen in your plan that you want to do, and it's in your mind. These are my steps, da 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 da. You know, and you do the surgery, and then afterwards, like, review what happened, and did I do the things that I thought I was going to do? Did I do something different? And, you know, and with each patient, you're learning from it, so you see their before and afters, and you say, okay, I did this thing, and this turned out well, and I like the way that looked, or if I did this thing, and it's okay, but I want it to be better, you know, like, and you're adjusting it every time. And so there's that stress, and so it's like being a kid, you know, and every experience is huge because that's your only experience, you know,
right.
And it's a brand new surgeon, you're like a baby surgeon, and every surgeon is huge experience, you know, and as you get more experience under your belt, the stress of it isn't as much, but I still mentally prepare like the big game for every surgery, you know, like that's my thing that I have to do, you know, we're like baseball players. We're like, I have my scrub hat that I wear, and yes, I wash it, but yes, I wear it a lot, and and I do the same thing with.
You have a lucky scrub hat?
I do.
All right. I mean, do you draw on it, or do you have like a special quote, or?
Someone gave it to me, and I just like the way it fits, and
okay.
And yes, I wash it, but I do wear it a lot.
She washes it.
I do wash it. Well, because that's the other thing that you're like, you wash it, right?
But it's a sterile environment, doctor.
It is, and yeah.
But still?
Still. You know, so like the stress of each case is less, and it's, for me, it's the transition from like every single thing about that surgery is stressful to I know what I'm going to do in the surgery, and I can control my part, and I need everybody else in that room to be at the same level, you know.
Like the anesthesiologist. I feel like that's a big one.
Yeah, and the good thing with being ENT is we work together a lot, because we, you know, like training as ENT, we work in the airway. Our areas are the same, and so we partner with them a lot, and so I have good relationships with a lot of anesthesiologists, because you know there's like the joke that like we're right here together, you know, like we're in each other's space, because I'm operating here and also their airway is here, and so the thing that they're concerned about, you know, like the ET tube and that sort of thing, like
ET tube,
endotracheal tube, so like the breathing tube.
Okay. Is that the one they shove down your throat? And
Gently. Gently, please.
All right, here we go. All right, Doc, you're up. Yeah.
So it's like I've gotten to where like I know the people around me and I trust those people, and you're building that team. But there's the point where you're like, okay, I feel comfortable with mine. I'm handing my baby over to this patient, and I need this wake up to be perfect because I just worked on them all day, and I need you to do your job perfect. So it's more that stress of I can only control this, and I can't control that, and that gives me stress. I can't control it, but I have to.
Is them waking up?
The going to sleep and the waking up and everyone else doing their job. Everybody has their job on the team. And like I said, I've got great people around me, but it was that stress of like, I want the going to sleep to be super smooth. I want the waking up to be super smooth.
Why? Okay, I'm sorry. Why would the waking up not be super smooth? Like, is it like
coughing?
Oh, okay. And then they've got the tube in there.
And and if they're like coughing, and so young boys wake up crazy. I don't know if you know this. They wake up crazy.
Really?
Yeah.
Okay.
And why? I don't know why. An anesthesiologist could give you a better answer. I don't know why. But if you're operating on somebody that is probably going to wake up and they're either going to tell you they love you or they're going to try to punch you. And you don't know what it's going to be. And so, like, there's certain people that do anesthesia and it's magic. They just wake up so gently and they're like, little angels and they're breathing so well and everything's wonderful. And, but then sometimes you get the teenage boy and he's trying to fight everybody and you just don't know.
Have you ever had somebody wake up and they're like, what'd you do to my face? And you're like, whoa, no way.
People,
really?
They grab for their face.
No.
And so and you have to talk to them, you hold their arms and you just had surgery because they don't remember. You don't remember those things, they grab for their face.
I mean, you just can't just handcuff them to the...
It's frowned upon.
I mean, because it seems like that would just nix that problem.
But then they'd fight you harder. Because if it's like that teenager thing of like, you hold me down, I'm going to fight you harder.
Okay.
So you have to like talk to them.
Yeah.
And, gently, remember you had surgery.
Okay.
Don't touch your face. And you have to remind them a bunch of times because of the drugs and all that kind of stuff.
Oh, my goodness.
So you want that angel wake up where they just like smile at you and you're like, oh, this is...
Yeah.
Sometimes they're like, did you start? And you're like, we're all done. Like that's a wonderful day. But you never know because every person's different,
Yeah.
And I've had people wake up from a facelift and roll over in the bed like an alligator roll. She was fine. Everything's fine.
Yeah.
But like that stuff like that's scary because the bed's tiny and
Well, and then the face.
in the face.
Yeah.
You've just operated on their face and got everything the way you want it.
Wow. Okay.
So it's that stress of like, and being a little, because all surgeons are a little bit of a control freak, of like, I want to control everything, but I can't control everything.
Yeah.
And being okay with
that.
I can't control everything. Oh. So I make sure I have people that
that can
that I control my piece and you control your piece, and then everything works really well.
Right. And before we give you this anesthesia, I need you to not act crazy when you wake up. Can you do that? Yeah. Wow.
We don't know.
What would you say would be the difference? I guess there are a lot of ways that you can answer this, Dr. Sturm, but what would you say would be the difference between your first surgery and your most recent one?
Stress. Yeah, I think the stress level is different. It's not near as, nerve-wracking of like, you have more experience, and so certain things are just muscle memory at this point. Like every person you're like present, but there's certain things that you do it because that's the way that you do it, and it just flows.
Because all the hot dogs look the same?
Hot dog's a hot dog.
Wow. Okay.
Yeah, the things just, it flows a little bit easier. And then from experience, okay, well, if this looks this way, this is the thing that I need to do to it to get it the way that I want it to look. And if it looks this way and these look kind of similar, but it's not because this one's not as firm as this one is. It's texture. It sounds weird. Surgeons are a different breed, or like if the cartilage is a little bit more firm, you need to do this thing. If it's not as firm, you do this thing. If it's,
I feel like I would be the personality, and I don't know if you've worked with the type who'd be like, yeah, it's not right. Can you give me something? I don't know. Is that a thing? Like, just kind of prodded a little, like the turbinates? Like, I don't know.
It's a lot by, vision, by how things look, how they touch, how they feel, how they, like your how things react to things. So yeah, you're definitely like touching and moving and like, okay, no, I need this. I need something else. This is not going to work. Or I need, that you can just, and that, not the turbinates, but this may be a long story, but whenever I do like revision rhinoplasties, I use a radiated rib a lot of times, which means somebody has donated their organs and it gets irradiated. So it takes all the cells out of it and you have these little pieces of rib that you can use. I can pick the perfect rib.
Okay.
Because it's cartilage and I can carve it into whatever I want. Your body reacts to it just like it's your own cartilage. And so with that, that's definitely no, this is not good. Give me a new one. No, or you're like, by the way that it feels, the way that it looks, that you're like, this is what I want.
Okay, so the rib that you didn't want, that didn't work out, it goes back, but can we use it for a different person, or is it because it's exposed to the?
Yeah, it's
kind of
done.
Done.
Yeah. So you try not to do that. You try to look through the package. Pick the
You're
best
window
one.
shopping.
Yes, and you're like, that one, that's the right one. But you may get one, and you're like, no. Because the cartilage can turn into bone over time, and so depending on the age of the person or just how they are made, part of it may be more bone and may not be as carvable as you'd want, or it's just squishy for some reason that I don't know.
So that's how Dr. Brissett made the ear from a rib.
Yeah, so he actually took that patient's rib, so he made an incision and took that rib out.
Oh, so it wasn't from a different patient. It was from that actual person. Oh.
That was from that actual kid, because they take the little piece here where it kind of looks like a C anyway, and then they carve it from that.
So I guess you don't really need all your ribs.
You do fine with some of them.
Huh. Okay. Okay.
There's redundancies in the human body.
But you need both your kidneys? I don't know. Maybe not. I don't.
No.
Yeah.
No, you can donate a
preferable?
kidney.
I don't know.
Yeah, I mean preferable. Yeah, just in case you gotta have a spare. You never know.
Goodness. One last question, Dr. Sturm. What is your favorite thing, because AI seems to have taken over just the universe? What do you see in terms of artificial intelligence helping you with productivity, helping with your practice, just anything involving what you do?
Most benefits probably from the practice standpoint of being able to have like an AI assistant that can help answer questions after hours, or help make appointments and help do things that, so we can be more available for people that are interested in the hours that we're not at work. So like that, it can help with some of the documentation, because if you're able to integrate that, it will make the documentation faster. And if you ask any physician, it's like hours of documentation, which is important, but it's an onerous task. So I think that can make that better. Some of my colleagues are looking at like using AI to create like ideal faces for like a surgical goal. Like, can you use an AI to, and I think that's a tricky one, to create, okay, this is our surgical goal. I think I use a Photoshop program because it is a good way to communicate, but it's not to the detail that like an AI would be, because AI does a lot. It may be hard to achieve surgically what you can do anything with AI, you know, and that might be hard to surgically achieve. But And they're using it for a lot of like research in our field of what is attractive? What is an attractive nose? What is, if you create 100 different noses, 100 different faces and different combinations, what is going to be the most attractive one? And what do most people agree on? What does, like asking a bunch of different questions that would be hard to do if you're like, okay, let's find a bunch of different faces, of pictures. You could do it much faster and easier to get to like objective kind of data that way. Like if we change this face, what would be the most beneficial part of the face to change if they're trying to achieve this or whatever?
It seems like that will be slightly overwhelming for the patient if they had all these options.
Yes.
It's like trying to find a movie on Netflix on a Friday night. It's like, I thought I wanted to watch a movie. You know what, Dr. Sturm, never mind. I don't need a facelift.
I'm good. Actually, I'm fine.
Wow.
It could be. That's my thing too, is like, how do we create something that is surgically achievable? And then how do we create something that is useful for the patient and not overwhelming, And I think all the different iterations are good for like research purposes, but not as much like clinical applicable stuff.
Gotcha. Well, Dr. Sturm, as always, you're a three-peat guest. As always,
I appreciate it.
It is so fun to be able to work with you and learn more about what you do. Obviously, there's so much more to rhinoplasty and facial plastics than one might think. Please, y'all, follow Dr. Sturm at drangela.sturm.com. I remember the website.
Yes.
I remember that. And Dr. Angela Sturm on Instagram and on TikTok. And y'all subscribe to our podcast, Beauty Unveiled, wherever you get your podcasts. Any final words?
I just want to tell you thank you for having me 3 times. This is always fun, and I really appreciate it and appreciate everything you're doing.
Thank you. All right.